Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying about leukopenia. Now from leukopenia you will be getting a short note. So you have to study this topic from a short note perspective. Let's start. What is leukopenia? Leukopenia means there is a reduction in total amount of WBCs, that is your white blood cells. Now, before jumping on to the complex thing, let me just explain you very clearly. Look at this. This is the normal slide which have a lot of WBCs also and a similar amount of RBCs also. But if you look at this slide, that is the slide of leukopenia, you are able to see that there is a decrease in the number of WBCs, right, as compared to the normal slide. So the normal WBC count is around 4,000 to 11,000, and if there is leukopenia, then the WBC count is reduced to less than 4,000. If the amount is less than 4,000, it is said that the person is having leukopenia. This much should be clear. Now, coming on to the classification. In the classification, what I want you to know is you have neutropenia. What is neutropenia? Neutro. The term is only suggesting that neutro means there is a decrease in the neutrophil count. So, if there is a decrease in the neutrophil counts, this means that the person is suffering from neutropenia. Lymphopenia means lymphocytes. There is a decrease in the lymphocytic count. Monocytopenia, decrease in the monocyte counts, and eosinopenia means decrease in the eosinophils, that is your red blood cells. This much should be clear to you before moving on to the complex things. Now, let's talk about the causes of leukopenia. First cause is when there is a decrease in the production of WBCs. If there is not enough production of WBCs, then how will the body of the person will produce a large amount of WBCs, right? There will be decrease in the amount of WBCs in that person's body. Now, this occurs due to bone marrow suppression or bone marrow failure, because we have seen that bone marrow is responsible for the formation of your WBCs. If there is a bone marrow suppression or there is a bone marrow failure, how will the WBCs be produced, right? That is a main thing. What are the causes and the mechanism? Causes is, first one is aplastic anemia, when there is a failure of hematopoietic stem cells. Chemotherapy and radiotherapy, they directly toxify the bone marrow. It is very toxic to your bone marrow. Bone marrow infiltration, when there is a replacement of marrow by tumors, fibrosis or granuloma. If the person is suffering from any tumor, fibrosis or any sort of granuloma. When there is nutritional deficiency, when the person is not consuming proper amount of food, when the person is not taking proper amount of food, then they like vitamin B12, folate deficiency and copper deficiency. Then you have your congenital disorders. In the congenital disorders, you have a syndrome, right? The next thing is when there is increase in destruction or utilization of WBC. Okay, what are the causes? The causes is, first one causes when there is immune mediated destruction. Now, what happens in the immune mediated destruction? There is autoantibodies against your WBC. Second, when there is hypersplenism, that means there is splenic sequestration of your WBCs. When there is severe infections like endotoxemia, sepsis, typhoid, this cause rapid WBC consumption. Next, when there is abnormal distribution of your WBCs, right, like temporary redistribution of neutrophils from circulating to your marginating pools. Coming on to the pathogenesis of your neutropenia. Now, what happens is there is first reduction in your bone marrow production. Okay, decrease in your production, you can say. Now, what will happen? As a result of which there will be increase in your destruction. When there is increase in the destruction, it will cause sequestration. And guys, you know what? Sequestration is nothing but there will be hypersplenism. There will be hypersplenism, right? Now, what are the marrow findings? In the marrow finding, I am able to see what? Hypocellular marrow and hypercellular marrow. In the hypocellular marrow, I have the defective production, and in the hypercellular marrow, I have the ineffective granulopoiesis, right? Coming on to the morphological changes. Now in the bone marrow, it can be hypocellular like aplastic and it can be hypercellular like compensatory. In the peripheral blood smear, see this is your peripheral blood smear slide. In that you are able to see that there is a decrease in the WBC, because this means that there is a decrease in the WBC, especially your neutrophils. Organs that are involved is your lymph nodes and spleens. Then is your mucosal surface, that in the mucosal surface you are able to see the necrotizing ulceration. Clinical features. What are the clinical features? You are having recurrent infection, malaise, chills and fevers, right? Now recurrent infection is due to any bacteria or any fungal infection. Malaise, chills and fevers are due to the infection, and ulceration are due to oral cavity and perianal regions and skin. Septicemia is common and may be life-threatening. Investigations. What are the investigations you will do for this patient? First, we will order the WBC, complete blood count. To see, in that we are able to see that there is decrease in the WBC count. Then we will order the peripheral smear. Why? Because we need to confirm that this is a type of leukopenia. Second is bone marrow examination. Why? To distinguish between the production and if there is production or if there is increase in the destruction. Then we will order the autoantibody test and we have to take the drug history of the patient. That is very, very crucial. This much should be clear to you. What are the complications? If the complications, the first thing can be, there can be severe septicemia and shock. Then there can be mucosal necrosis and ulceration. Then there can be any urinary tract infection and there can be death if it is uncontrolled and untreated. Coming on to the management. Now, management portion I have divided into goal and your. What is your goal? First one is to remove the cause. So you have to approach this to stop all the offending drugs which are causing this reaction. You have to stop that. Second is to treat the infection. How you will treat the infection? By giving the broad spectrum antibiotics and antifungals. Third, stimulate marrow recovery by GCSF, that is your fluid analysis. Then protective isolation is to prevent the infection, and you have the marrow transplantation in severe or congenital cases. You will do that. What is the prognosis? The prognosis depends on the severity and the underlying cause of the disease. Then it is transient neutropenia. Then chronic or aplastic form have a very, very poor prognosis. What are the key differentials you need to keep in mind? First one is your leukocytosis. This means there is increase in the WBC count. Then is pancytopenia, means decrease in all cell lines. We will study about pancytopenia also, okay? Aplastic anemia can be your differential diagnosis. Then is your myelodystrophic syndrome. These are the differential diagnoses which you need to keep in mind. Now, I have made a very, very beautiful summary table for you all. For your last moment revisions, what are the things you need to keep in mind? Features, decreased production and increased production, right? First feature is your bone marrow cellularity. Decreased production and increased destruction, it is normal. Then is your marrow myeloid precursor. They have a decreased production and increased destruction, may be normal or increased in the immature form. Response to GCSF, in decreased production it is poor and in increased destruction it is good. What are the examples? Examples of decreased production is chemotherapy and aplastic anemia, and in decreased destruction the example is your autoimmune and drug-induced immune destruction. This thing you need to keep in mind while writing the answer of your leukopenia. This much is sufficient from a short note perspective. I hope I made myself very, very clear. And if you have any sort of doubt, please don't hesitate. Please feel free to ask me. Please feel free to DM me. Thank you so much.